Welcome to the fourth program in our series about family involvement in care. This program builds on earlier content about communication, assertiveness, and negotiation, which are all important in developing partnerships with providers. Today, we'll talk about developing the partnership agreement itself. As a reminder, this program is one part of our training series focused on creating a partnership approach to caregiving, which involves working as a team to assure your loved one with dementia receives the best possible care. Being a partner with providers relies on good communication, negotiation, and clarifying roles, as well as asking questions or for explanations, bringing up concerns with the care routines or treatments, and being prepared. Before we get started, let's look at a few tips from family caregivers on being a partner with providers. Work with the team to determine how much or how often you want to be involved in your loved one's care. For example, do you want to be called to talk or visit with your loved one when he or she becomes upset? Don't feel guilty about setting limits. Recognize and speak up about your needs as a caregiver. Let the provider know if you are feeling overwhelmed. Ask questions about available resources that could help. The guiding beliefs about partnerships to improve quality of life and care are all person-centered. That means both family and providers are focused on the person, not the disease or even the task at hand. Consideration of individual values, experiences, preferences, and characteristics that shape needs. Being compassionate and respectful. And the notion that the partnership approach to care is really a way of thinking differently about both relationships and care, not just the services a provider may offer. An important factor in building partnerships is the information family members can offer to the provider to help them really know the person with dementia, to better personalize the care and routine based on lifelong habits and preferences. The partnership approach helps family members to feel involved in their loved one's care, as well as helping to ensure quality of care. The back and forth sharing of information helps to promote better outcomes for everyone involved, particularly the person with dementia. Today, we will be going into more detail on the key elements of a partnership agreement and the process to form that agreement. Key elements of a partnership agreement include health and quality of life needs of the person with dementia, contributions of family and staff participants, specific goals, specific activities, and desirable outcomes to monitor the effectiveness of goals and activities. An important starting point is that partnership agreements should be designed to fit the specific needs of the situation and providers involved. There is no one right way to formulate an agreement, and the partnership depends on many factors such as the provider, setting, or type of care, and the typical communication style. Agreements can be a simple informal verbal agreement of shared understanding, or in many situations, a more effective approach is to have a written agreement. The first step in establishing a partnership agreement is to gather information about family needs and goals for care. Let's take a break for discussion. What do you think is important to share with providers for them to have a better picture of who your loved one is? How could you best share that information? Please pause the presentation now, and then when you are ready to continue on, press play. The partnership approach also recommends gathering information about the person with dementia, including the individual's level of function in daily activities, physical self-care abilities, cognitive function, and preferred recreational or leisure activities. Gathering information about the care setting is important as well. Is the setting home, assisted living, day services, or another setting listed here. It is also important to note the frequency or type of care provided, as well as any policies of the provider regarding family participation. Now that we have gathered the information needed, the next step is to negotiate the agreement. The partnership agreement includes goals for the person with dementia that are a win-win for both the family and the provider. That means the pros and cons are balanced, so the goals can be achieved for all parties. The agreement should include outlined and specific roles for both family and providers, and clearly defined desirable outcomes for the person with dementia, so each party knows if the care approaches are working or not. The discussion of physical care and psychosocial needs may result in differing views on what is best or practical. Laying some ground rules at the beginning can help you and the provider stay on target. First and foremost, remind everyone of the main goal for having the discussion, providing the best care possible for the person with dementia. Encourage everyone to actively listen and make a commitment to finding mutually acceptable solutions. Next, identify the person's specific needs in terms of their physical care, their psychosocial and leisure needs, and observed behaviors. Once the specific needs are identified, work to align activities to address and meet those needs. When discussing activities, remember to be specific and discuss what activities will be done and by whom. Discuss the roles of the family caregivers as well as the roles of the provider. Once the decisions about approaches to care are made, the next step is to clarify desired outcomes. What do you hope to see, and how will you know if the plan is working or not? Finalize the partnership agreement in the preferred format, whether that is a verbal discussion or in a written format, such as including it in the service plan, care plan, or other working document. Prepare for the future by keeping in mind that changes in function and abilities of the person with dementia is part of the disease progression. Also, discuss what will signal the need to renegotiate the plan. After the partnership agreement has been created, the next step is to share and communicate the plan with everyone involved in your loved one's care. Sharing decisions made in the partnership agreement with others is important so that everyone can be involved and help to support the plan. Review the plan with other family members, either through personal discussions or via phone or email if family is long distance. Place the agreement in the care plan or service plan and share the plan with other providers that are involved in your loved one's care, such as physical or occupational therapy, home health, palliative care, or hospice care providers. As with anything involving dementia care, it is important to keep in mind that as the disease progresses and needs change, the plan will also need to be reviewed, updated, and changed. It is important to be prepared and plan ahead. The signals that the plan may not be working also need to be clearly identified and communicated among staff and family alike. Decide how feedback will be gathered and shared. When will the agreement be reviewed again, and what happens if new or different issues show up prior to the agreed-upon review date? Using these steps to create partnership agreements with providers can help to navigate difficult conversations and decisions to reduce the stress on yourself as a caregiver, as well as providing the best quality of care for your loved one. Let's take a minute for discussion. How do you prepare yourself for meetings like care conferences or service plan meetings with the provider, especially when you may not know what direction the conversation may go? Please pause the presentation now, and when you are ready to continue on, press Start. Partnerships between family and staff can greatly improve the quality of life and care for the person with dementia. The process relies on good quality communication. using principles of negotiation to reach win-win solutions, recognizing that change is constant in dementia care, and being ready to let go and try a different approach as the person's needs change over time. In the next two presentations, we'll talk more about challenging behaviors that are often the focus of care and, in turn, family-provider partnerships.